I'm Dr. Anil Gode. I'm a consultant in reproductive medicine and assisted conception at Fertility Plus and Fertility courses. So the question we asked today is, how good is the ultra-long protocol in IVF, especially with endometriosis? And this was just paper which looked at the study, and it's quite interesting. It was a very short study and it could not be completed, and there were reasons for that. What we know is that endometriosis stage 3 and stage 4 have significant impact on IVF outcomes. There have been studies which suggest that in severe endometriosis, IVF with ICSI has lower chance of pregnancy. So a few years ago, and it looks like in 2006, a paper came up which says that if you did a prolonged downregulation, then you're more likely to be able to give a better chance of pregnancy. Now, that was not based on live births. To a certain extent, it was based on pregnancy. If you give a long protocol, you would end up giving a better chance of pregnancy. So if you had a look at this paper, which again looked at the effect of prolonged downregulations, what did we not look at? So in this study, what did they plan to do? 3 to 6 months of the ultra-long protocol using GnRH agonists to suppress the endometriosis, and that was the logic. And then the other cases, they used the long protocol, which means suppressing the pituitary gland for a period of 3 to 4 weeks and then starting the stimulation. 20 patients with severe endometriosis in both the groups, and the live birth rate did not change. In fact, if you looked at the cumulative pregnancy rates, those who did not have the ultra-long protocol had a slightly higher clinical pregnancy rate, and live birth rate based on a cumulative. And when I say cumulative, it means that it is taking the fresh and the frozen cycle together. Now, my opinion on this paper is that this study was interrupted because very few patients wanted to go on the 3 to 6 months course of long acting GnRH analog. And for a reason, it has side effects. It gives you hot flushes, mood swings, can give osteoporosis. And my concern is that in some cases, you also see a drop of follicle count. And when you see a drop of follicle count, you're going to get lesser number of eggs. So that's the reason I would not do it in my practice. So here, when you looked at this study, and what do we gain? I think there's a lot of work to be done yet. And we think that in these cases, you better to go in without a long protocol, and we'll be able to try and avoid putting somebody on the ultra-long protocol. And I think as studies take place, we would be moving away from giving women long course of GnRH analog with its negative impact. The second problem that tends to occur is that what happens when you give the ultra-long protocol? Let's say one treatment goes through and it's unsuccessful. The pituitary gland does not go back into action for another 3 to 4 months. And secondly, you are losing the impact of the dual trigger, which is so very important in some cases of IVF. So